So it is about the lung volumes along with the capacities. So let's break it down. Now we are going to look at the components of the lung volume. So to begin with, the components it includes the TV. So what is TV? TV is nothing but the tidal volume. So the tidal volume, the definition, the description is that it is the amount of air. It is the amount of air that moves into the lungs. So they are telling it moves into the lungs. So amount of air which moves into the lungs with each inspiration. So it is with each inspiration. With each inspiration, or the amount that moves out with each expiration. So it is with each inspiration or with each expiration. And with expiration, it is the air which is moved out. So during quiet breathing. So all this in case of quiet breathing. Hope it is simple to understand. So the tidal volume is nothing but, shortly it is known as TV, and it is the amount of air which is entering the lung during inspiration or expiration, all during a quiet breathing. So what is the normal value of TV? So the normal value of TV is nothing but it is 500. It is 500 to about 750 ml. It is that much. And next we are looking at IRV. So the tidal volume, this is similar to that of a water bottle. So 500 to 750, easy to remember. Now we are looking at IRV. IRV is the inspiratory. IRV is the inspiratory reserve volume. So when you look at the IRV, inspiratory reserve volume, it is the air which is inspired. So air, it is inspired. So you have the lungs. So air is entering the lungs, and this is with forceful inspiration. So you do a lot of force. So forceful inspiration. So in terms of forceful inspiration, the maximum amount of air which can be drawn. So this is the amount of air inspired with the maximal inspiratory effort in excess of the TV. So this is in excess of TV. So this is nothing but the IRV. So this IRV, it can go up to 3L, that is a 3 liters. So the TV was about 500 to 750, which we told. It's easy to remember. Now next comes IRV. IRV was 3 liters. So IRV is a very huge number. Next we are going to see the ERV. So IRV was close to 3 liters. So ERV, so the definition is that the volume expelled. So it is a volume which is expelled. So you have the lungs and it is expelled. Okay. So the volume of the expelled by an active expiratory effort after passive expiration. So by passive expiration. So there is the volume which is expelled by an active expiratory effort, and this is after passive expiration. So what is the value here? So value of the ERV is nothing but 1.1 liters. So next we move on to something known as the RV. So what is known as the RV? So RV is nothing but it stands for the residual volume. So RV is nothing but the residual volume. So what is it? It is nothing but the air left in the lungs. So it is the air which is left. So where is the air left? So air is left in the lung, and it is after a maximum expiratory effort. After maximum expiratory effort. So the individual, he continuously with maximum effort, he tries to expire. So he tries to remove all the air from the lungs, and whatever is left is known as the residual volume. So what is the residual volume amount? So this amount is about 1.2 liters. Next we'll move on to the something known as the TLC. So what is this TLC? So TLC stands for the total lung capacity. So it is nothing but an addition of, there is IRV, there is TV. So IRV, there is TV, Next, there is also the ERV along with the RV. So there's IRV, TV, ERV as well as RV. So all this amounts to a large amount. So it is in liters and it is 5.8 liters. Next, when we look at the VC. So VC is nothing but the vital capacity. So under the vital capacity, the amount is, there is IRV, there is TV as well as ERV. So the only difference between the TV and the VC, the difference was in case of RV. So we saw that RV is nothing but the after maximum expiratory effort, whatever is left is known as the RV. And in case of VC, the RV is left. So we are left out with the IRV, TV as well as the ERV. Next, we will look at the inspiratory capacity. So what is IC equal to? So IC is nothing but, it is nothing but the TV plus the IRV. So IC is nothing but the TV plus the IRV. And what is the amount? It amounts to about 3.5 liters. Next, when we look at EC, EC is nothing but the expiratory capacity. And this is about TV plus the ERV. TV plus the ERV. And what does this amount to? It amounts to about 1.6 liters. Then we move on to the something known as the FRC. So FRC is nothing but the functional residual capacity. So this FRC, it is nothing but the ERV plus the RV. And how much is this amounting to? So this amounts to about 2.3 liters. So this was completely about the lung volumes and the capacities. And we have gone through each and every component that is measured in case of the lung capacities. And we also discussed the normal values. So this was about the topic. To learn and grow daily, please do subscribe.